Hello and welcome. I am so excited to be here today. My name is Ashley Rollins and I am a doctor of physical therapy at Origin, and we're here today to talk about getting to know your pelvic floor. So at Origin, we are a pelvic physical therapy clinic that was really born out of the mission of supporting women and individuals with vaginal anatomy in every stage of their life. We offer non-invasive, affordable care for commonly overlooked health issues, everything from painful sex to postpartum recovery. At Origin, we believe that there is no such thing as TMI. As a quick reminder today, all of the information, content, and materials in this presentation is for informational purposes only and is not intended to serve as a substitute for consultation or diagnosis or substitution for physical therapy treatment of a qualified healthcare provider. So let's dive in and kind of learn more about our pelvic floor. Again, I'm Dr. Ashley Rollins. I'm a physical therapist. I specialize in pelvic floor physical therapy. So I treat pelvic floor muscle dysfunctions, including pelvic pain, sexual dysfunction, pregnancy-related pain, postpartum recovery, and bowel and bladder dysfunction. And I am so excited to kind of dive in and get you all the information you need to know about your pelvic floor during all of the stages. So we'll talk about your pelvic floor, kind of talk about what the muscles are, what is normal, how normal function is felt, and then the changes that can occur in pregnancy, in labor and birth, in the postpartum period, and then of course talking about when to work with a physical therapist to further help support your healing and your concerns with your pelvic floor. So what is my pelvic floor and what does it do? You may have heard about a pelvic floor, but what are we specifically talking about? We're talking about this group of muscles and connective tissues that make up the floor of the pelvis. I kind of think about it like a hammock or a basket of muscles. They run from the pubic bone to the tailbone and then left and right between the two sit bones. So they form the floor of your pelvis. I kind of think about them like water underneath a boat. So the water underneath the boat kind of helps to support it, keep it buoyant in its position in the dock. And your pelvic floor muscles do the same thing for your organs. They help to support them and maintain their positions and functions in your pelvis. So what are the functions of your pelvis? What functions of your pelvic floor? So these muscles and how they're positioned, again, they support your pelvic organs. They hold them up against gravity. They also tense and squeeze and close around the pelvic openings. So the pelvic openings are your urethra, your vagina, and your anus. And they help to close and surround and squeeze those openings to help keep you continent and prevent leaking. They also provide stability to your pelvis. So your pelvis is like the foundation, the center of your body, this really important center area that your pelvic floor muscles support. It's your trunk, your arms, your legs kind of move on your pelvis, and your pelvis is responsible for maintaining stability and strength in that area of your body. It functions really as part of your core. We might think more that like our abdominal muscles are important to stability and balance, and they are. But together, your pelvic floor muscles, your abdominal muscles, some muscles in your low back and your diaphragm, they work together to help support your movement and your function. They also support sexual function. So muscles that are strong and flexible really to support healthy sexual function for erection, pleasure, and orgasm, but also when they're tight and tender and stiff, they contribute to pain and inability to tolerate sexual arousal or vaginal penetration of any kind. They also, like the muscles in our legs and our lower body, they pump and squeeze and pump to help with circulation of our blood and lymph flow. So how do they work exactly? These muscles contract to kind of close in and lift, and they relax to lengthen and open. Again, the urethra, the vagina, and the anus, they travel through these muscles. So these muscles really to help to kind of support those functions and those openings. The pelvic floor muscles squeeze and lift to help prevent leakage. They squeeze and tense to provide support and stability. They also release and lengthen. That releasing and lengthening is important. It's necessarily for pain-free sex. It's necessary for having for emptying your bladder, empty your bowels. And we also can use these muscles to kind of further lengthen, or maybe you might call it something like bearing down, the muscles can release from a contraction and they can further open and lengthen to help with a vaginal delivery or a bowel movement, to prevent any kind of resistance and decrease pain there. The muscles work together, like I mentioned before, with your abdominals, your diaphragm, your hip muscles. They work together. They're stronger together to provide support to your core, and give you balance and function. So what is normal? Those muscles, they contract, relax. Well, what does that mean for your bowel function, for your bladder function, for your sexual function? So let's look at urination first. It's normal to go to empty your bladder 5 to 6 times a day. You shouldn't be running to the bathroom every 20 minutes to an hour. You want to go every 2 to 5 hours throughout the day for a total of about 5 to 6 full bladder voids. You shouldn't experience any leaking. You might experience some if you've had a vaginal birth. You might experience some leaking in the first 6 weeks in the postpartum period, but this is really the only time that we really consider it normal. Those tissues may be injured or bruised or kind of stunned after birth, so leaking can be normal. But after that point, you shouldn't, or before, you shouldn't experience any leaking of urine or stool. You should be able to easily and completely empty your bladder, so you should be able to sit on the toilet and release and relax and fully empty your bladder without needing to strain, without having pain, without needing to push or kind of move your position around. And you shouldn't have any sensation of urgency. So this might be like this sudden strong urge to void that you can't really control and you find yourself rushing to the bathroom. For bowel function, you should see 3 bowel movements a day to 3 bowel movements a week. There's a lot more variability in what's normal there, but more than 3 bowel movements a day is too frequent, and fewer than 3 a week might be too infrequent. You also want to look at what your stool looks like. We have here a picture of what's called the Bristol stool chart, and really it's just kind of like this diagram of all of the ways that your poop can look. And it gives us a lot of insight into what's going on with your diet, your hydration status, the ability for your gut to kind of move stool through your system. And it can really help us kind of come up with a plan of how to help your bowel movements. We like to see, between type 3, type 4, type 5, kind of more the softer, easy to pass stool types. Maybe 3, 4 are optimal on the Bristol stool chart, where really your stool is smooth, it's easy to pass. Type 1 and type 2, those are a lot harder. They may be painful to pass. And then type 6 and type 7, they're too thin. It's harder to kind of hold back and keep yourself continent with those thinner bowel movement types. So really working on optimizing what your poop looks like. So don't be afraid to look. It can really help you out and kind of telling you where to go. And you shouldn't have any pain or feeling that you need to strain to empty your bladder. You can push a bit, but you shouldn't be feeling like you're holding your breath and straining and struggling. And then, of course, sexual function should be pain-free. It should be pleasurable. It should be easy without any kind of resistance or pain during vaginal penetration of any sort. So this is with tampons, pelvic examinations, a finger, a toy, a penis, anything should be pain-free and pleasurable. So that is normal. So then what happens in pregnancy and labor and vaginal births? That's what it is in the normal state, and prior to pregnancy, what we had all just discussed. So in pregnancy though, your pelvic floor muscles get put through a lot. During those 9 months, a lot changes. You have hormonal fluctuations. Your posture adjusts. The joints in your body will soften and expand in preparation for the growing fetus and for birth. But it can leave them more susceptible to injury. So pelvic floor muscle strengthening is generally always advised if you are cleared medically for strengthening. It can prevent complications like urgency, incontinence, and prolapse, or at least reduce your chances during pregnancy and in the postpartum period. A strong functional pelvic floor can also provide improved stability to your pelvic girdle and helps to decrease pain in your pelvis and your back. When we have in pregnancy, there's so much excessive movement and changes that go on in our pelvis that a lot of times when we have a stronger, healthier muscle function, it can compensate for a lot of the changes that are occurring and might be contributing to pain, and helps keep you functioning and moving in a healthy, happy way. A healthy, strong pelvic floor muscle can also support the normal fetal cardinal movements during labor and birth. These are really kind of how the baby is maneuvering down the birth canal. And a nice, healthy, supple pelvic floor muscle that has good range of motion can help to support that. It allows for more movements of the pelvic joints. Remember, those pelvic floor muscles, they are attached to the bottom of the pelvis and surrounding those pelvic joints. Your sacroiliac joint, your pubic joint, your coccyx, your tailbone. And so if those muscles are tight and restricted and they don't allow for movement, then those pelvic bones can't move how they need to, and the baby isn't able to maneuver as easily either. So pelvic floor muscle strengthening is advised. Kegels are kind of what you more commonly hear or think of when we talk about pelvic floor muscle strengthening. And this is really just the pelvic floor contracting and releasing. And the key is releasing. We want strong muscles, but we don't want to hold them there. That can overwork them or leave them more susceptible to overactivity and fatigue. So we want to learn to strengthen and release those pelvic floor muscles, especially in preparation for birth, because we need those muscles to release and lengthen and move out of the way during a vaginal birth. In fact, we oftentimes will work with patients to learn how to push, to effectively push the baby out and support the normal physiologic process of birth. Those pelvic floor muscles need to open and get out of the way. And it's not as easy as you might think. Oftentimes when we are pushing down, our muscles can get a little bit confused, especially during something like a big life event like birth, or especially if there's injury, or especially if you have an epidural and you're not really aware of those pelvic floor movements. We want to be able to practice pushing prior to, I guess, the big day. Some ways that we do this, sometimes we encourage you to look at your pelvic or your vulva with a mirror to see if you have the release and lengthening, opening of those muscles. You can practice while you're pooping, because that's that normal opening and lengthening movement. And oftentimes, if we're working with birthing positions, we'll encourage practice in those as well, since that's when you're really be using them anyways. But while strengthening, we do often encourage exercising in different positions. This can be your body, kind of depending on how you're positioned and how your muscles are being stressed, can perform differently. There's increased weight or pressure on your pelvic floor muscles in certain positions or less. So it may be easier or harder to squeeze and use your pelvic floor muscles. Some positions we note here, like side lying on your hands and knees or sitting, those are all very helpful ways to use and practice strengthening your pelvic floor. It's not very common for you to have leakage or pain when you're just kind of sitting there quietly. It's during those movements when really you're challenged, and so being able to practice exercises during certain activities that irritate your symptoms can be really helpful. So how about the postpartum period? What do we do after the baby is here? In the first 6 weeks after a delivery, leaking urine or a feeling of heaviness is okay. It should improve spontaneously as you're healing through those first 6 weeks. It shouldn't stick around. It's okay to start doing gentle Kegels, like with a breath and engaging your pelvic floor muscles. This is really just kind of gently turning them on and releasing them. This really kind of emphasizes that normal circulatory function of the pelvic floor muscles that kind of help with circulation and lymph flow, blood and lymph flow. So kind of gently engaging and releasing your pelvic floor muscles and your abdominal muscles can help with circulation and reducing swelling, and kind of like waking your muscles up after delivery. We need to use them for all of our daily functions every time you have a bowel movement or go to the bathroom or move. So we want to make sure we're doing that correctly. Sometimes we'll encourage Kegling with a breath. So on inhale, we can release our muscles. On exhale, contracting them. It's a movement that happens normally, but bringing your awareness to that, especially in the postpartum period, can be really helpful. After 6 weeks, you need to have your OB or your midwife clear you for any type of vaginal penetration. If there was any injury or tearing while your cervix is healing, whatever it may be, even if it was a cesarean section, introducing things to the vagina, be it a tampon, a toy, a penis, whatever it may be, might introduce bacteria or disrupt any wound healing that has been established. So we always encourage no penetration in those first 6 weeks. But after that, your OB or your midwife will clear you. If you are still having symptoms of leaking or pain or heaviness, it's no longer considered okay. And it's no longer something that we're like, okay, it's just okay. It's okay. You're healing. It's no longer normal. We want to have resolution by this point. And if you're still having those symptoms, it's worth bringing up to your provider or seeking out pelvic physical therapy to try and help improve your symptoms at that point. You can start doing more strengthening after a 6-week period. You can use things such as a pelvic floor trainer. We have them pictured here over here on the left. We have the Kegel, the LV, or the PeriFit. Those are really good examples of like the fancier technology-based Kegel training applications. There is a device that you can insert that kind of sense what's going on in your pelvic floor, and it will run you through exercises. They're really pretty cool and help to kind of keep you motivated for some of the exercising in the postpartum period. So that's just to begin. But what about the rest of this, postpartum period? How to navigate the next year or years after having a baby, and really why no one should ever just put up with their discomfort in this postpartum period. So kind of draw your attention to this statistic. About 85% of birthing people will experience injury in their pelvic floor during a vaginal delivery. There is a lot of stretch and pressure that is being placed upon your pelvic floor muscles during a vaginal birth. And there's a lot of stress and strain that has happened to them during pregnancy as well. So if you had a cesarean, you're not spared here either necessarily. But don't worry, we've got you here. So let's talk a little bit more about pelvic floor exercising in the postpartum period. Pelvic floor injury can lead to a variety of symptoms. Bowel changes, leakage, bladder leakage, urgency, frequency, sexual dysfunction, sexual pain. Proper healing is really the key to kind of helping restore those functions to where they were. Kegels are important, but your symptoms might be caused by dysfunction of the muscle power, the endurance, its coordination. It may not just be that you need to squeeze and release those muscles. We might need to work more on their endurance or their function with your other movements or muscles. So it's important to vary your exercises. Not just Kegels. Oftentimes we can incorporate other core strengthening that can also benefit your pelvic floor muscles and your whole body as well. If your muscles are overactive or too tense, then actual Kegel exercises or pelvic floor muscle strengthening exercises can make your symptoms worse. This can be common after a cesarean delivery. Remember, I said that your pelvic floor muscles are not spared just because you had a cesarean delivery. You still had 10 months of pregnancy, and we got to remember that a cesarean is a major abdominal surgery, and your muscles can oftentimes kind of go into this protect mode, protect and freeze and tension mode. In those instances, Kegels are not necessarily what will help them to heal. A tight muscle doesn't need to be further tightened. It needs to be released and given the range of motion back. Oftentimes it can present as a weak muscle because it's tight, it doesn't have anywhere to go. When we can restore that range of motion, we can then recover some of the strength that it needs. If you experience more leaking, urgency, or painful sex while you're doing Kegels, it's a sign to stop. A pain is always a sign that maybe something further is going on, and sometimes it can mean that maybe your muscles are not long and weak; they are tight and painful, and they need to be released before you strengthen them. Diaphragmatic breathing is one way that we encourage this. It's really a good way to learn that release. When we breathe through our belly, we inhale. And our pelvic floor muscles naturally lengthen and expand with the inhale. So the inhale, they open, exhale, they kind of come back up to their starting position. So using that breath, this normal movement of our pelvic floor, and then drawing our attention down to our pelvic floor muscles to kind of feel that movement and what it should be doing is a great way to start the release and coordination of your pelvic floor muscles. So beyond just kind of getting our muscles, getting our bowel and bladder function, how to return to exercise? A very, very common question, because at 6 weeks, you're cleared for pretty much everything. And it leaves a lot of us kind of going, but what? But how do I do this? If you just set off on a run, we have a picture of a runner here. If you just set off on a run, you're more than likely going to experience, your body's going to be jolted. There might be pain, there might be heaviness, there might be leakage. Those are all signs that maybe you're not ready to just jump right back in where you left off. Even if you stayed active throughout your pregnancy, it's really important to respect your body and the changes that it's gone through all of it. You want to start slow and ease back into exercising to avoid injury. I always recommend starting with, so after you're clear for 6 weeks, starting with more stabilization, strengthening exercises, gentle, low impact, like walking at varying speeds, to get your body kind of back, like getting its coordination and the connective tissue that was overstretched and the muscles that were injured, kind of getting them back into the groove a little bit more gently. And then after 3 months, kind of progressing to the more high impact activities such as running or high intensity interval training or any of the CrossFit activities. Start slow. Around 3 months isn't where you jump back in either. It's when you start with increasing your impact. You've set the foundation with some of the stabilization exercises, and then you introduce impact. And then paying attention to those symptoms. Am I leaking more after I introduce impact? Do I have more pressure or pain? Those are all signs that you need to slow down and go back a couple of phases in your return to exercises. This doesn't mean that you can't do the fitness that you used to love, though. We always recommend starting, with a lower level or introductory classes. Just have fun, move your body, and find a way to kind of feel like yourself again without overly stressing your tissues. So bowel and bladder function we talked about, how to return to exercise, and how about returning to sex after having a baby. This can be a very scary, anxiety-provoking discussion. You may be anxious and ready to return, but there are many reasons why there could be fear or pain associated with that return to having sex. It doesn't have to be that way, though. But let's just talk first about the ways that can contribute to a less comfortable sex. Very normal to have decreased lubrication, especially while breastfeeding. You had so much estrogen just kind of bathing your tissues in pregnancy. And in the postpartum period, they mostly go away. With breastfeeding, lower estrogen supports milk production. So it is your normal estrogen levels are lower, and your vulva and vaginal tissues love estrogen. They are thicker and more moisturized. They have more self-lubrication when you have normal estrogen levels. So your tissues may be thinner and drier, more painful in the earlier postpartum periods. In fact, around 55% of women report this low estrogen, low vaginal lubrication levels in the postpartum period. And you also may have scar tissue. So if you had any tearing in the perineum, so the perineal body is the space between the vaginal opening and the anal opening. And it's very common to tear down into the perineal tissues. And remember, I said about 85% of persons after a vaginal birth will experience trauma to their perineal area. So scar tissue can form. That's a very normal process. Our body has an injury, it heals with scar tissue. But that can become tender. It's a less flexible tissue. Sometimes it can affect our muscles. It can decrease the blood flow. It can irritate nerves in that area. So scar tissue isn't always, it can become a reason why sex is uncomfortable in the postpartum period. And you also might have overactive or tense muscles. Remember, during sex, those muscles need to lengthen and open. But If you have injury in that area, they might respond with tension and overactivity. Or if maybe you were working so hard at trying to return to get rid of some urinary leakage that you overtrained your pelvic floor muscles, and now they're tender and sex is painful. You also may have birth trauma or post-traumatic anxiety that could be affecting your return to sex after the baby, or you're exhausted and touched out after taking care of the baby and feeding it all day long. And so you got to respect all of the body changes and discomforts in the postpartum period. But you deserve pain-free and pleasurable sex, and it is possible. And physical therapy can help. If we have those muscles that are tight and overactive, we work with trying to normalize the tissue length and helping remodel some and soften some of that scar tissue. We always recommend using lubricant. It's a really use as much as you can. It can be fun. There's some really awesome lubricants out there, and you deserve them in the postpartum period. It really can help to kind of compensate for what you're naturally lacking. Also, practice diaphragmatic breathing daily. Again, it's that way. That's one of the first things that we encourage for kind of teaching those muscles how to relax and release and lengthen. So practicing your diaphragmatic breathing or stopping doing your Kegels, especially if you're having pain, is a good place to start. And then go slow and communicate. Everything is different in the postpartum period, and oftentimes what was working for you prior is not going to be comfortable for you in the postpartum period. So communicate this with your partner. Set up an action plan or if this hurts, I'm going to stop type of plan to kind of reduce any fear that you may have associated with returning to sex, which will only make pain and apprehension worse. And of course, don't force it. If your body isn't ready, then you wait until it is, and work with your pelvic PT if pain is arising and you have some concerns related to your pelvic floor muscles or scar tissue. So when to work with a physical therapist. Kind of touched on it a bit throughout the presentation, but the signs and symptoms of pelvic floor muscle dysfunction are vast, and they include things like leakage, so leakage of urine or leakage of stool, or even just smearing it or smearing on the underwear. Just any amount isn't considered normal after that 6-week point, even if you had kids. You might also experience urgency. So that's like that sudden uncontrollable urge that you got to rush to the bathroom. Or frequency. You're going more often than we talked about. 5 to 6 trips to the bathroom to empty your bladder is normal. But if you're going once every 20 minutes or once every hour, it's too frequent. And there might be something going on with those pelvic floor muscles that are contributing. If you're having any sort of feeling of heaviness or feeling of falling out, it might indicate something like pelvic organ prolapse that occurred after a pregnancy or delivery, and would be a symptom that you're feeling that might be a good idea to check with your pelvic PT. And of course, any type of painful sex, painful penetration of any kind of a tampon, exam, whatever it may be. Speak with your OB or your healthcare provider and let them know that these symptoms are popping up and you're concerned about pelvic floor muscle dysfunction. And of course, if you had any tearing or scarring, a cesarean delivery, scar tissue needs to be helped or encouraged along the way and in the postpartum period, and is a wonderful reason to check in with your pelvic PT. So some of these common conditions we treat: stress urinary incontinence, you may have heard of, but also urinary urgency, pelvic organ prolapse, scar care, pelvic or low back pain. And like I mentioned at the beginning, we really are caring about the whole body and throughout your different life stages. So this includes things like neck and back pain, maybe pain with breastfeeding or holding babies while feeding. Maybe you had an abdominal muscle separation. You may have heard of diastasis rectus abdominis, where the abdominal muscles naturally open and spread in pregnancy to make room for the growing of your abdomen and the baby, but the tissues can kind of thin and weaken and create dysfunction in the whole abdominal system. So seeing a pelvic PT to kind of help restore your abdominal integrity can be really helpful. And then we can also work with you to safely return to exercise. We talked about kind of maybe a slow progressive way to return to exercise, but everybody is an individual. And everyone's unique and has their own sets of circumstances and barriers to returning to exercise. Working with a physical therapist can be really helpful in kind of nailing that down and individualizing an action plan to kind of get you feeling like yourself again. We also see patients for something called mommy thumb or deep curve veins, carpal tunnel, any types of wrist lifting, holding injuries that can really be painful and really inhibit some of your normal baby care or daily activity types of activities, holding, diaper changing, all of those things. We kind of take for granted our wrists until the until the baby comes. And then, of course, mastitis or clogged milk ducts in the postpartum period can occur, and we can absolutely help you with those complications as well. Anything else, really anything that gets in the way of your optimal function, check in with your pelvic PT, and we can certainly get you started on an action plan, even if it means finding the right providers for you, building your village of support in the postpartum period. So that is it for the presentation today. I really hope that we were able to kind of provide you with some information and new knowledge of your pelvic floor and your body before pregnancy, during pregnancy, and birth and beyond. If you have any questions, please reach out. Check us out on Instagram at The Origin Way or at theoriginway.com on our website, and we're happy to get you scheduled for a visit to kind of see what's going on with your body and help you get to feeling your best in the postpartum period. Again, my name is Dr. Ashley Rollins with Origin, and I appreciate your time today. Thank you.